Okay, I'm back. This is Dr. Susan Blum. We have had technical difficulties. I know it's late. It's Tuesdays at 1 o'clock with me for lunch every Tuesdays. Today's February 21st. Welcome to Facebook Live. I apologize the past 10 minutes. We actually had to switch iPhones. For some reason, my phone is not behaving, and I think for next week we're going to have to figure out what's going on. So I got myself reset up. So hopefully we're good to go. The microphone doesn't work on the iPhone 7, which I'm using Sarah's phone, so hopefully the video is going to come across okay, and I'm leaning in a little bit so that you can hear me better. So welcome to Facebook Live. Okay, well, nothing like a little bit of stress and, troubleshooting to sort of get your juices going on this Tuesday morning after a long weekend. I hope everybody had had a day off yesterday like we did. The office was closed, and that was sort of fun. And the weather here in New York was fantastic. I hope you all got outside. I actually went hiking in the preserve and trudged through the snow, and it actually was a very good workout because the trails weren't completely melted, and so we were sort of trudging through the snow with the dog. But it felt so good for me, and I can see why. I don't typically get seasonal depression, and I'm not depressed, but I can definitely feel my mood lifting after walking outside, being outside again. So I'm really looking forward to spring. Okay, enough about that. Today, I think many of you know we were putting out some promotional information to share. That today I was going to talk about inflammatory arthritis, specifically rheumatoid arthritis, but also other sort of inflammatory arthritis conditions. The treatment and the approach is somewhat similar, so we can really talk about them all in a similar context. For many of you who might not know this, I wrote a book. I just finished my book called Healing Arthritis, and it's going to be released in the fall of 2017, October 2017. And so the manuscript's all done, and we're doing all the final, it's in production with my publisher, and so I have arthritis on the brain. I've been really thinking about this topic. I've been researching it. I'm really up on the latest research and what we know about what causes arthritis, how to treat it, the best approaches, the underlying triggers for inflammation. And I want to share some of that with you today. So let's start first by just definitions. And so here's sort of what we're going to talk about today. I want to first talk about the types of arthritis, because this can be very confusing, and sometimes it's hard to know what kind of arthritis you have. And people come in often and they'll be a little confused about this. So definition number one, the difference between an arthralgia and arthritis. Okay, new words. So arthritis, to have an itis, to have inflammation, means that there's redness, swelling, pain, and heat in one of your joints. Now, it can be one of your hands. In rheumatoid arthritis, really the hands are typically involved, and that helps make the diagnosis. But you can have redness, swelling, pain, and heat in other joints. They could be in your knees or your toes or your feet bones or your ankles or your wrists. So you can have, and in your spine, right? So you can have inflammation, redness, swelling, and heat, and pain in any joint of your body. But typically, if you have rheumatoid arthritis, or if you have arthritis in one of your fingers, you're going to see it, and it's going to be swollen, and it's going to be tender. And that's called arthritis. An arthralgia is when you have some pain in one of your joints, but you don't see anything. It's not red, and you don't have a big swollen finger or joint, but it hurts. You definitely feel a little joint pain, and that's called an arthralgia. So that's not quite on this, that doesn't bring you, maybe think of it like a spectrum, right, of very mild, early potential arthritis is the first sort of pain that you might have. So when so it's important, and even if you have an arthralgia, it's important to think about that there is low-grade inflammation in your body, and so it's important to look at those causes of inflammation and address that as well. So even if you just have an arthralgia, you should pay attention to what we're going to talk about today. It applies to you as well. But I do want to focus on people with arthritis. So moving along to what is arthritis, and there's a whole bunch of categories of arthritis. And so the first, I'd say the three big quick categories to sort it out is inflammatory and autoimmune arthritis, of which rheumatoid arthritis is one. But there's also a category called spondyloarthritis diseases, which is psoriatic arthritis, ankylosing spondylitis. Those are primary inflammatory autoimmune arthritis conditions, like rheumatoid arthritis, sort of like cousins. And then you also have the arthritis from rheumatic diseases, which is, for example, if you have Sjogren's or if you have lupus, you might have true arthritis as part of your disease, as part of your other diagnosis. And so we call that inflammatory arthritis of rheumatic disease. Now, some people have something called undifferentiated arthritis, which just means that they don't have a diagnosis of any of those things I mentioned, but they definitely have arthritis. And a lot of times people will call that, or they'll get diagnosed with seronegative or early RA. And the idea is, again, if you have this spectrum, and maybe arthralgia is at the beginning of the spectrum, someplace along the way you might be getting some arthritis, but your blood tests and other testing aren't positive yet for any of those diseases. And so in that sort of in-between space, you might be given a diagnosis of what they call seronegative RA, which is just sort of early potential rheumatoid arthritis without any kind of lab tests that are positive. You might be given something, I mentioned both of those, undifferentiated arthritis, early or seronegative rheumatoid arthritis. And those are people in the middle without any conclusive testing, but we think you're going to end up with one of those inflammatory arthritis conditions. So that's definitions. That's the whole category of inflammatory arthritis. Now, there's the other two big categories for arthritis, which we're not going to talk about today, or I'm not trying to get to talk about today, is osteoarthritis, and we'll do that another day all by itself. That's also called degenerative joint disease, or arthritis after an injury, or repetitive stress, or getting older. That's when there's arthritis in the joints from other causes like that. And so that's osteoarthritis, and we're not talking about that today. And the third big category is arthritis from infections, so Lyme, mold, other viruses, parvovirus. You can have terrible arthritis for 6 weeks and then it goes away. So sort of infections that are triggering arthritis. And then the only other one, actually, I just realized I should mention that isn't technically an inflammatory arthritis is gout, right? So gouty arthritis is when you have uric acid crystals that settle in the joints and trigger inflammation. So it is an inflammatory type of arthritis. So that's sort of the spectrum. But today I really want to focus on RA, rheumatoid arthritis and its cousins, which are all those cousins I talked about. Spondyloarthritis like psoriatic arthritis, ankylosing spondylitis, and even the autoimmune diseases. If you have lupus or Sjogren's and you have arthritis with that, this talk is for you as well. So where does inflammation come from? And then we're going to move on to now causes of inflammation. In functional medicine, how do we approach this? A lot of people come in to see me. I treat a lot of arthritis, which is why I wrote the book, because my first book, as a lot of you know, was on autoimmune disease and really covering the gamut of all autoimmunity. And I, through seeing thousands and thousands of people with autoimmune disease, I became an expert in treating arthritis as well. And I really, and in the past 5 years, there's been maybe 10 years, but really the past 5 years, the research connecting inflammatory arthritis with the gut and gut health and leaky gut and dysbiosis, which we've talked about many times, and my colleagues and I are busy talking about the gut microbiome now. All of us. It seems to be that we can't talk about any chronic illness without talking about the gut these days. But when it comes to arthritis, the research is conclusive. The research is really very, very clear. And this is conventional research. This isn't any left-wing integrative sort of mumbo-jumbo, which of course I don't believe I'm doing anyway. But I'm just saying this is real bona fide good research showing that people with arthritis, any kind of inflammatory arthritis, and especially RA. There's a lot of research on RA in the gut. There's a lot of research on RA and the gut microbiome, those bacteria that live in the gut, the kinds of bacteria that are there, the relationship between rheumatoid arthritis and leaky gut, which I'm going to talk to you about a little bit with my diagram here. And the research has become so clear. And I don't want to say the word conclusive because, you know, in 5 years something will be disproved and it won't really be conclusive. But we really, the associations and the causality that's showing in the research these days is really compelling, I think is the right word. And it's compelling enough that it should direct how we treat these diseases. It tells us what we should do to help people heal. And this is how I've been working with arthritis all these years, is fixing the gut. Of course, working with food, stress, and the gut. Now, when we talk about the gut, what do we mean? And this is, I want to show you my diagram here to sort of help you understand what happens with the gut. Now, think of your intestinal lining. This is a very simplistic diagram, which is why I actually really like it. This is a very simplistic diagram, which is why I actually really like it. I'm repeating myself. Because you can see here, there's something called your intestinal lining. And your intestinal lining is supposed to form a complete barrier between you and the outside world. So think of it, it's not only one cell layer, but here it looks like it is, but that's okay. So it's pretty much, it's something called epithelial cells, and they line your whole intestines, small intestines and large intestines. And they're supposed to provide a barrier, and you can see there's something called tight junctions. These little circle things, JC means junctional complex. So that's the tight junctions. And there's this glue that's supposed to seal the spaces between these cells. Now, here's your intestinal lining. On one side, you have these little dots here says microbial and dietary antigens. And what that refers to is the 100 trillion bacteria that live inside your gut, along the whole lining of your gut, of your whole small intestine and large intestine. Now, 90% lives in the colon, 10% of those 100 trillion live in the small intestine, so most of them are in the large intestine. But inside your gut lumen, we call it, which is the tube, inside the tube, on this side of your barrier, are all these bacteria. The other thing that's there is food, right? You're eating your food. Your food comes down and gets digested, and it's hanging out all inside your intestinal lumen. It's getting digested and metabolized, and the bacteria help you do that. And what happens is this barrier is supposed to keep the bacteria and the food here and only allow what comes into the body to be really well digested food that doesn't have what's called antigens, recognizable proteins that are sort of the name tags of that food should be gone. By the time you bring it in, it should be like amino acids and fatty acids, just nutrient particles that come in, and the epithelial cells help bring them in. Now you can see down here, here's your immune system, and as Sarah joked with me, they look like fried eggs, you know. That's actually, they're called antigen presenting cells, but these are just diagram of immune cells. And what I want you to just know from this, not the names of the different cells, is that on the inside of your body, this is the intestinal lining, and right on the other side of it is where 70% of your immune system lives. It's hanging out there waiting to protect you from what you bring in to your mouth every day. You bring in the outside world every day through your mouth, and your immune system is here waiting to make sure everything's okay. You know, that it'll protect you in case anything bad comes in. Now, the immune system also is here to protect you from the 100 trillion good bacteria. They're not supposed to interact or see those bacteria. They're supposed to have this lining that is a wall between your immune system and these bacteria. And so this is a gut that is a healthy gut. Well, pretend you don't see that arrow there, and that's a healthy gut. Now, what happens when there's a leaky gut, and you've all heard that terminology before, so this is a great talk about leaky gut. What happens is, for different reasons, which I'm going to share with you in a minute, the glue between the cells gets damaged. and we call it sort of damage to the tight junctions. And when there's this damage, sort of a conduit opens. There's a leakiness, and all of a sudden you get cell wall proteins of the bacteria. So name tags, the bacteria, recognizable components of the bacteria that live in the gut, get seen by your immune system. That's not good, because your immune system starts having an ongoing sort of reaction, which causes inflammation. The other thing that happens is food particles start getting into your body, and your immune system starts seeing the food particles. And so what happens when your immune system sees the food particles? It reacts to the food, and you get a food sensitivity. And so people ask me all the time, I mean, of course, you know, whenever I give people the bad news that there's favorite foods that they're going to have to stop eating, the pushback is always, but wait a second, how's that possible? I've been eating this food my whole life. Like, why all of a sudden can't I eat corn? I grew up eating corn on the cob, my favorite food. And what I explain to people is, your whole life, maybe your gut was okay, but now you have a damaged gut, and your immune system has been looking at that corn and doesn't like it anymore. And so you develop food sensitivities because of the gut. And so if you have noticed and you've determined from an elimination diet or any kind of blood testing you've done that you have a lot of food sensitivities, it's not so much the food's fault as it is the gut's fault. Now, I will backtrack a little bit and say, and this is sort of how food, when I say treat the causes of inflammation for arthritis, you have to look at food and figure out which foods might be triggering inflammation. And that's the very first thing that you do. And you can do that on your own very easily. And so we do that with an elimination diet. It's very simple. I mean, it's not easy to implement, but it's a simple concept. Gluten, dairy, soy, corn, eggs, and sugar, right? Any place that you're getting obvious sugar. Processed food. Clean up your diet. The other thing for arthritis that's really important are called nightshade vegetables: tomato, potato, eggplant, and peppers. For some reason, there's a compound in those foods that trigger arthritis, that trigger the pain and inflammation and swelling of arthritis for people. And it all has to do with these compounds getting across the leaky gut. How am I doing on time? Okay. And so you have to discover for yourself whether food is triggering inflammation for you. And if you have arthritis, I guarantee you that you do have some triggers for food. You have to, because arthritis is associated with a leaky gut. And if your gut is leaky, then you are going to be having food triggers. And so the most common ones are the ones we remove in an elimination diet. Now, I know I blamed food. So a lot of people have food sensitivities because of their leaky gut, but I guess I can't leave the topic of food without just making a comment that our food has changed too. So it's not just about the gut, and that there is, like soy and corn, for example, are the most genetically modified of all the foods we eat. I mean, most of the soy and corn in your diet, unless you're specifically eating foods that say non-GMO, organic, it's probably genetically modified. And GMO and genetically modified foods, when you eat them, what the studies are showing is that they damage these tight junctions. They actually cause damage and increase leaky gut. Pesticides, pesticide residues, glyphosate, which is Roundup, it's the most common pesticide that's used, damages the leak and causes leaky gut. Stress can directly cause a damaged gut. And alterations in your microbiome, the wrong bacteria can cause a leaky gut. And how do you end up with an overgrowth of the wrong bacteria? The most common reasons are antibiotics, chronic use of antacids like proton pump inhibitors, a standard American diet, eating lots of animal, fried foods, sugar, processed flour products, not eating enough of gut healthy food like fruits and vegetables, phytonutrients that include flavonoids and fiber, and so vegetarian whole foods that look like they are when you pick them, they help you grow the good stuff, right? So having the right kinds of bacteria, because the bacteria, as you can see, they live right here and they interact and they protect your lining. The good flora protects your lining. They ferment healthy food and they release something called short-chain fatty acids that protect the tight junctions and heal them. And so you can have a healing pattern in your gut flora, or you can have bacteria that are more inflammatory. And the standard American diet, like I was saying, fried foods, living on, and this is where paleo people have to be very careful. The paleo diet is not a gut supportive diet. And so I really advocate eating more like a Mediterranean diet, although with arthritis you have to worry about the tomatoes, potatoes, eggplant, and peppers, which are very Mediterranean in nature as foods. But I think that number one, treating the cause. So circling back to the point, and I want to sort of come back here for a second, is treat the cause of your arthritis. Fix your food, which means eating a lot more fruits and vegetables, foods that support the good bacteria, and do an elimination diet to remove those foods that we think might be a problem now for you. The other cause is this whole leaky gut. And how do you heal a leaky gut? You have to repair the microbes and have healthier microbes, and you have to repair your intestinal lining. And I teach you how to do that on my website, blumhealthmd.com. I have a whole Heal My Gut program because this is so important, and this is what I do day in and day out. And I've been doing this with people online, and we have a lot of great resources for you on the website for how to heal your gut. You have to heal your gut. Number one thing for people with arthritis, because then eventually, once your gut is good, you'll be able to eat some of those foods again. So the food elimination won't necessarily be forever if you heal your gut. The only last piece I want to add about stress as a really important trigger for inflammation in the body is that if you're busy doing the right stuff, like you're eating healthy and you're eating a gut healthy diet that's supporting the microbes, you've rebooted the gut bacteria, and the way that I do that is with herbs, and this is what I talk about on my website. Using herbs like herbal antibiotics to weed the garden and prune out those bad bacteria and yeast and even parasites that might be in there mucking things up. Probiotics, you're working on your gut health. Stress can really derail your efforts. Stress can come along and just sort of knock you sideways. And what stress does is it can directly damage those tight junctions. It can directly cause leaky gut. It directly influences the gut bacteria. And it directly will affect your digestive enzymes and the stomach acid that you have. And that affects the downstream microbes, which is why PPIs and antacids are so bad for your gut microbiome, and eventually really promote the development of leaky gut. When you take antacids, proton pump inhibitors, Prilosec, Prevacid, Tums, all that stuff for too long, you end up in a really bad situation like this. And so I just want to leave you with that idea and that thought that stress can, for some people, they could have gotten here with you could have gotten to the point of having inflammation in your joints from chronic, intense, ongoing stress, which has damaged your gut. You could have gotten here from your diet after all these years, which has damaged your gut. You could have gotten here because you've damaged your gut from other reasons, right? Alcohol, separate from diet and stress, right? Alcohol, medication, antacids. I think that you have to keep all those things in mind. And so at the end of the day, we want to treat the root cause of it all. And so before I finish up, I think I'm winding down, right?
One question.
Oh, there is a question. Before I answer your question, I just want to say about medication. If you're on medication, you can work on your gut, and you can fix your food, and you can address your stress and practice relaxation every day. What I'm talking about in terms of treating the cause of your arthritis does not change anything. You can do all these things while you're on medication. So I just want to say that. And as you get better, you can talk to your doctor about tapering off the meds. Okay, so I wanted to make sure I added that at the end to sort of wrap things up a little bit. Okay, question.
How can I tell which arthritis I have? One doctor told me it was psoriatic, and another doctor said it's rheumatoid.
Okay, very good question. The difference between how to know whether you have rheumatoid arthritis or psoriatic arthritis. People with psoriatic arthritis, so the two different arthritises have a different pattern usually. Rheumatoid arthritis usually affects hands and feet. You usually have that involved. Psoriatic arthritis will often affect the back or larger joints. So the location is often important. Psoriatic arthritis will also often affect what's called enthesitis, the insertion of tendons. So if you also have inflammation where you're having a lot of tendinitis, Achilles tendon especially, you might actually have a spondyloarthritis. Spondylo means back. So rheumatoid arthritis and psoriatic arthritis, which is a spondyloarthritis, like I said, it can affect the back and it can affect the tendon insertion. So there are different patterns of arthritis. You can often differentiate these on x-ray, so you can get an x-ray of your hands or an x-ray of the joint, but usually the pattern and with an x-ray is usually one of the ways to really make the differentiation. The other way, I'm assuming that, to answer your question, none of your rheumatoid arthritis blood tests were positive, because that's why they're not sure, or that you didn't have psoriasis. So when somebody has psoriasis, often they're given the diagnosis, or history of psoriasis ever in your life, they're given the diagnosis of psoriatic arthritis. If you have a positive blood test for rheumatoid arthritis, like rheumatoid factor, or a CCP test, which is a cyclic citrullonated peptide test, it's called CCP antibody, either of those puts you in the category of rheumatoid arthritis. So sometimes there's overlap and it can be confusing, and so I do think sometimes doctors sort of wait and see. They do this sort of, well, we're not really sure, but eventually it'll become clear. From my perspective, I just want to let you know that if it's not obvious, which tells me that you didn't have psoriasis and you didn't have any of the positive blood tests for rheumatoid arthritis, what we know is that you have an inflammatory arthritis. And maybe it's considered undifferentiated at this point, and it's in that spectrum. You have to fix your gut and fix your food, and your arthritis. The good news is you probably are not that far along yet, and this should be very reversible for you if you repair your gut, lower inflammation, manage your stress, and really fix your food. And so I think that this kind of program is exactly perfect for you. And until my next book comes out on arthritis, which explains to you exactly how to do the arthritis program, you should just follow the immune system recovery plan, heal the gut section in my book, or go to the website and I can, we take you through exactly how to do that. Okay? So that wraps me up today. I know I started late and I apologize, and I hope I don't have a microphone today, so we made it happen today, even though we had a little bit of technical glitches, and by next week we'll have that sorted out. Have a great week and happy rest of February. Spring is around the corner.